The purpose of this video is to provide an overview of depression so you can gain a better understanding of the condition. This video will identify some risk factors, signs and symptoms, and treatment options for depression. As humans, we all experience a variety of emotions on a daily basis. It's normal to have feelings of sadness, anger, and happiness. Usually, we are able to overcome the negative feelings. But what happens when the sadness lingers a little too long? What happens when sadness is coupled with sleep problems, anxiety, changes in appetite, or other unwanted thoughts or symptoms? Depression is regarded as one of the most commonly diagnosed mental disorders. Though it is common, that doesn't make it any less severe. When experienced, symptoms of depression should be taken seriously and not ignored. Individuals often prioritize other things such as their job or tasks that must be completed over their own mental well-being. Perhaps you are guilty of doing this. You can only ignore your symptoms for so long before they begin to become more problematic. It is ideal to seek treatment earlier rather than later. It is best to get professional help rather than depending solely on someone with no formal training in mental disorders. Sometimes, untrained persons do not know what to say and may appear insensitive. Have you ever experienced sadness for more than a few days, weeks, or months? Were you told to suck it up and get over it? Yeah, not such an easy thing to do. I mean, if it were that easy, no one would be depressed. You can't just suck it up because there are a number of factors that may contribute to the development of depression. Biological factors, genetics, psychological factors, and environmental factors are all thought to play a role in the development of the disorder. Just think about it. A person can be predisposed to developing depression prior to birth. Major life changes, severe or prolonged stress, exposure to traumatic events, and family dynamics may enhance the risk for depression. The type of environment that you live in may also contribute to the condition. For example, individuals who live in an impoverished area or areas with high crime rates may certainly find themselves at risk for depression. Depression may also be present in an individual diagnosed with a chronic illness such as Parkinson's disease, HIV, heart disease, diabetes, and cancer. Have you ever had the flu and felt sad, irritated, or just didn't want to be bothered with others? Just imagine what others with chronic illnesses might feel like and the impact that their condition may have on their mental health. It is common for chronic medical conditions to exacerbate or worsen in the presence of depression. It is also good to remember that some medications can contribute to the development of the condition. Have you ever wondered if children can become depressed? Well, yes, children can be affected. Children may display irritability instead of sadness. This important clue is often missed by the caregivers of the child. Therefore, it is important to report any behavioral changes to your child's medical provider. So, how is depression diagnosed in the clinical setting? According to the Diagnostic and Statistical Manual of Mental Disorders, this is the standard for diagnosing mental conditions. An individual is required to meet a certain criteria for diagnosis. To meet the diagnosis of depression, the symptoms must be present for at least 2 weeks. Signs and symptoms must be present most of the day, nearly every day, for at least 2 weeks. There are also questionnaires that are used to screen the individuals for various mental disorders, including depression. These items are used in conjunction with the information obtained during the psychiatric evaluation to form a diagnosis. What are some symptoms of depression? Some common symptoms are as follows: decreased energy or fatigue, moving or talking more slowly, appetite or weight changes, loss of interest or pleasure in hobbies and activities, feelings of hopelessness, negative thinking, persistent sadness, feelings of guilt, irritability, worthlessness or helplessness, aches or pains, headaches, cramps, or digestive problems without clear physical cause or that do not ease even with treatment, anxiety, feelings of emptiness, difficulty concentrating, remembering, or making decisions, thoughts of death or suicide attempts, difficulty sleeping, early morning awakening, or oversleeping, feeling restless or having trouble sitting still. Although these symptoms may be present, it doesn't necessarily mean that you will be diagnosed with depression. There are a few other conditions that must also be ruled out prior to making the diagnosis. For example, conditions such as bipolar disorder, cyclothymia, and dysthymia also share some of the same symptoms as depression. What are some treatment options? There are a variety of antidepressant medications available for the treatment of depression, such as Prozac and Lexapro. Psychotherapy is another popular and effective treatment for depression. I personally recommend both treatment options when a patient is experiencing difficulty participating in therapy due to their symptoms. Although medications are often prescribed for the treatment of depression, they are not always necessary. I recommend discussing your treatment options with your provider prior to making a decision. Have you been told by a friend or family member that they had to try more than one antidepressant? Unfortunately, there is no way to determine if a particular medication will be effective for you. Everyone is different, and what may work for some may not work for you. It is important to be in tune with your body and emotions. This will help your provider to determine if you are progressing with treatment or if the medication should be adjusted or changed. It is also important to be aware of any side effects so that they can be reported to the prescriber. Most importantly, you have to actually take it every day to determine if it will work. So, what are some side effects of the medications? Your provider should explain the side effects of the medications to assist you with making an informed decision prior to consenting to the medication. It is important to note that just because a side effect is listed, that does not mean that you will experience it. However, there is a possibility that the side effect will occur. Common side effects of antidepressants may include suicidal thoughts, increased symptoms of depression, decreased libido, insomnia, drowsiness, nausea, headaches, elevated blood pressure, seizures, and diarrhea. What can I do to help decrease my symptoms or risk for depression? A few tips for helping you with coping with the symptoms of depression are journaling to record your feelings on paper. It is not necessary to save the writings if you do not want to. Take time to relax, meditation, self-help books, connecting with friends and family, taking a walk, getting sunshine, exercising, eating healthy, focusing on positive things instead of negativity, and getting enough sleep. What should you do if you know someone who may be showing signs and symptoms of depression? It is important to be sensitive and supportive. Do not tell them to snap out of it and get over it. This will only make things worse and cause them to shut down or feel more depressed. You should try to get them to seek professional help. Seeking help for your mental health does not mean that you are crazy or that someone will lock you up in and throw away the key. Sometimes, individuals just need a little extra help. People often say, "I thought I could do it on my own." This isn't always true. Why experience symptoms for years when you don't have to? If you have been diagnosed with depression, please comment and tell us how long it's been going on, if you received treatment, and if it was effective. If you haven't received treatment, tell us what is hindering you from doing so. I would like to thank you for taking the time to view this video. I hope you found it helpful and educational.